Mic testing.
Going to take action.
Hello, this is Dr. Deepak Sharan, Chief Scientist and Founder at Recoup Health.
Hi, my name is Dr. Gulati. I'm Medical Director and Lead Consultant Physical Medicine and Rehabilitation at Recoup Health.
Hi, I'm Dr. Visalam, Integrative Medicine Practitioner at Recoup Health.
On this Doctor's Day,
we are more than happy to answer
your health questions.
So the first question is from Rekha. I have knee pain. Am I allowed to go for morning walks? Of course. Contrary to a common belief, walking does help in a knee pain. As you walk, your muscles get strengthened. You get the requisite amount of vitamin D, which is required for you to maintain your strong bones. And overall, you lose weight because knee is a principal weight bearing joint. So losing weight is very important in case you have knee pain. So we suggest you to go for your morning walks even if you have knee pain. But there are two ground rules. One is you should walk on a plain surface and walk with a good quality footwear. That is very important. And alongside forward walking, you should do backward walking also, which would improve your balance, coordination and strengthen your thigh muscles.
Khatija asks, I have got rheumatoid arthritis. Can I do leg exercises like squats? In general, remaining physically active and also doing certain exercises to improve strength, flexibility and balance is recommended in all types of arthritis, including rheumatoid arthritis. But this should be best done under the guidance of a physical medicine and rehabilitation physician and a physiotherapist.
RRR asks, how do we fix hormonal issues through yoga? Can hormonal issues be fixed through yoga? The answer is yes. How through yoga? You can start off with pranayama, you can start off with multiple Surya Namaskaras, but it depends upon what hormonal issue, which hormonal issue you're facing. Whether it's woman hormonal issue, men hormonal issues, or it's a thyroid, adrenal, there are so many hormonal issues. So depending on that, your yoga will vary and change. Yoga can be a part of your treatment, but can it be solely your treatment? Maybe not.
Munira asks, is it possible to live a pain-free life without medicines? I have chronic inflammation due to rheumatoid arthritis. So, at least a quarter of patients with rheumatoid arthritis can potentially go into remission and stop medicines in the long run, provided the treatment is started early and aggressively. Even in other patients, if you are able to identify the associated conditions such as inflammation, nutritional deficiencies, hormonal problems and so on, and address it in an integrated root cause approach, the dependence on medicines can be reduced and perhaps even overcome.
Sharon John asks, severe migraine around menstruation, around 7 to 10 days, unable to work, how do I get a diagnosis? In my practice, Sharon, most of the migraines are caused by gastroesophageal reflux disorder. And especially during menstruation, you have low acid production, which might cause increased gut symptoms. And that is what is causing your migraine. So sort your gut out through integrative medicine practice and you will be pain-free during your menstruation.
Next question is from B. Sarkar. Why do I have leg cramps? I'm 65 and I take no medicines. Of course, medicines or iatrogenic cause is one of the prime causes of leg cramps, but there are several other causes as well. Dehydration, electrolyte abnormalities like reduction in sodium, potassium, chloride, etc. can cause leg cramps too. Certain kidney problems like chronic renal failure can also cause leg cramps. Anemia is one of the prime reasons for leg cramps as well. Stretching your calf muscles, that is gastrocnemius stretching, can lead to leg cramps. Going for exercises without proper warm-ups or limbering down can lead to those muscles getting into a spasmodic mode. Overusing or underusing your knee joint, flat feet, injury, etc. are some of the prime reasons for leg cramps. So medicines are not the only reason for leg cramps. So it is very important to hydrate yourself properly, to take proper nutrition, proper diet, go for proper warm up and limbering down while you are exercising, and using a good quality footwear to avoid leg cramps.
V asks, I have had neck pain, muscle loss, weight loss, gastro issues and radiating pains since 2 years. Each specialist only sees his areas. No tests or reports really showed anything except for minor posture related changes. How do I approach this, and can different specialists come together to check this? So we follow an integrated root cause rehabilitation approach where an interdisciplinary team of functional and lifestyle medicine physicians, physical medicine and rehabilitation physicians, Ayurveda, naturopathy and yoga physicians, physical therapists, occupational therapists, nutritionists, clinical psychologists, etc. come together as a team, evaluate the patient, make a comprehensive and holistic care plan and implement it till optimal recovery is achieved. The advantage of this approach is that we harness the benefits of each therapeutic approach, besides ensuring there is good coordination and no issues due to professional egos.
Sohni asks, can you lose weight if you've had hypothyroidism for the last 18 years, out of which it was untreated for about 11 years? Current weight is 85 kilograms, height is 4 feet 10 inches and my age is 60. I have high cholesterol, grade 1 fatty liver and high blood pressure. Yes, you can lose weight if you're hypothyroid. Hypothyroidism will decrease your basal metabolic rate, and that is why you add on weight. But if your hormones are under control, you can lose weight. Irrespective of your height, blood pressure and everything, if we can put your thyroids normally, if we can decrease your systemic inflammation, your weight will reduce.
Mukund asks, my left shoulder is in pain since 1 year. Give me some remedy. Several conditions related to the joint, the tendons, the muscles, the bone, the nerves can lead to pain around the shoulder. A thorough evaluation by a physical medicine and rehabilitation physician, perhaps followed by a structured rehabilitation approach, which may include manual physical therapies, regenerative procedures and pain interventional procedures, and all of these done together can give good long-term results.
Next question is a very good question from Ramnik. Can I drive a manual car with a meniscal tear? Meniscus is basically a ligament which is between your thigh bone, that is femur, and your leg bone, that is tibia. Meniscus acts as a cushion for your knee joint. Meniscal tears are extremely common, but in India we drive manual cars as well, and it puts a lot of stress on the knee joint when you maneuver clutch, brake and acceleration on your car. So it is very important to get your meniscal tear assessed by a specialist, and he may order an MRI or an ultrasonography test. There are 3 grades of your meniscal tear. First is a meniscal sprain, second is the partial tear, third is the complete tear. So we need to ascertain what grade of meniscal tear is there. Second, we need to ascertain how much pain is there. How much stiffness is there is also very important if you want to drive a car with a meniscal tear, because meniscal injuries are very often accompanied with swelling, which is going to create problems. So get all these 3 points assessed. You can use a brace while you are driving with a meniscal tear. You should take breaks, you should not go for long drives. You can have a medication before you go for a drive, and make sure you get yourself properly assessed whether you are fit for driving or not, because it is very important to consider your own safety. Next question is from Nidhi. I am having severe backache and problems in L4 and L5. Can I live a normal life again? Of course you can, Nidhi. The prevalence of low back pain in India is about 84%. That means 84 people out of 100 have experienced low back pain at any point in their life or are experiencing it right now. So you are not alone. In case you have a problem between your L4 and L5, the most probable causes could be a herniated disc, or a facet joint arthropathy, or a sacroiliac joint problem, or probably a simple muscle spasm. So it is very important to ascertain the root cause of low back pain. Once we find the pinpoint cause of low back pain, it is very easy to give you a personalized, comprehensive, interdisciplinary rehabilitation program that can treat most of your low back pain. Whether it is mild, moderate or severe, it can be treated so you can live a normal life again.
We have 3 questions. Priya asks, I have got ulcerative colitis since 27 years and due to that I have osteoporosis, thyroid and cholesterol. Ruxana asks, my menopause is on and I am taking all multivitamins, omega-3 and vitamin D tablets. But my knees started aching and what should I do? Raju says that he gets tired easily. He has frequent urination. He has joint pain in the fingers, especially the middle one. Our approach is we evaluate the patient initially using the Recoup entire person health score. There is a subjective score which is based on a questionnaire answered by the patient, and there is an objective score based on lab parameters and biometric recordings. After this, there is a thorough evaluation which includes an intake questionnaire, medical symptom questionnaire, metabolic assessment questionnaires and some others. The physician evaluates the patient, tries to find out the root causes of the presenting condition as well as the various physiological imbalances that may be present. A care plan may be made and several other professionals may then be involved in the care, including nutritional interventions, psychological interventions, Ayurveda, physical therapy, occupational therapy and so on.
Paddy asks, how to cure a patient with SLE and lupus? Paddy, that's my entire education. I don't know how to answer it in that 1 minute, but SLE and lupus can very well be managed through integrative medicine because both are autoimmune diseases and the causes are either toxin levels, nutritional deficiencies or mental trauma. And you can treat them with diet, movement, sleep, mind, chemical detox, nutritional supplements and therapies. Disciplined lifestyle, you can treat SLE and lupus.
The next question is from Mr. Himmat. I have a spine problem, back pain and cervical pain. What is the best treatment? So Mr. Himmat, back pain and cervical pain occurring together has become a common occurrence, especially after COVID pandemic. Most of the patients that we encounter these days have pain in the whole spine, that is from the neck to the lower back, they have a pain. And the most important reason for that is bad posture. So get your posture corrected, get posture analysis done, get the ergonomic workplace analysis done where your workplace can be analyzed and your sitting desks, sitting chairs can be ergonomically modified. Do some stretching exercises, hydrate yourself well, get some proper nutrition or proper diet, make sure your metabolic diseases are under control, take some medications, take physical therapy, and these problems can be curtailed. Back pain and cervical pain problems occur in more than 2/3 of the adults who are working class in India these days. So it is very important to get the posture analysis done for that.
Priyanka asks, I have heavy flow during periods. Can something be done? Of course, yes, Priyanka. Can something be done is the second question. Should something be done? The answer to that is yes. You cannot continue heavy bleeding every month because that will lead to a lot more complications in terms of anemia, energy lack, hormonal imbalance and so many other things. Can something be done? The answer to that again is yes. If you ask an integrative medicine practitioner, yes, hormones can be put back to balance and you can start bleeding normally like every other human.
This Doctor's Day, I would like to give the message that most chronic diseases can be effectively addressed by an integrated root cause rehabilitation approach, addressing not only the condition but also ensuring the longevity of the person, quality of life and lowering of biological age.
Thank you so much for trusting us with your health in your life.